So it's an absolutely beautiful day today in the UK, and because it's nice and sunny, I have a barbecue planned out because that's a really big thing here. And I'm prepping in the kitchen, cutting some vegetables, and I managed to slice my finger off. Now, here's the thing, I try all the home remedies. I try bandaging it and wrapping it up, but the bleeding isn't stopping. So what do? Now, I obviously want to call the GP, but it's a weekend. So the GPs and the surgeries are all shut. Yikes, what do I do now? Is this how I die? Now, here's the thing. The healthcare system in the UK is pretty great, but it's probably different from what you're already used to. If you're coming from another country like I did, it's probably going to be very different from what you've already been doing in your home country. And because healthcare is so important, it is absolutely necessary for you to know how to navigate the entire healthcare system in the UK, and more importantly, what to do in times of an emergency. So in today's video, we're going to be talking about how you can navigate the entire healthcare system in the UK and get access to doctors, dentists, and healthcare professionals. Now, if you plan on living in the UK, the really good news is that the UK has a publicly funded healthcare system called the National Health Scheme, or the NHS. Now, even though it's said to be free, it's not exactly free because you technically pay for it through your taxes and the health surcharge that you, if you're planning on moving to the UK, will be paying as a part of your visa fees. When you move to the UK, you'll be paying a health surcharge as a part of the visa fees for yourself and your dependents, which basically funds the NHS. All residents of the UK get access to healthcare, including expats like you and me when you move to the UK, and this also covers your dependents. Now, the health surcharge you're looking at paying is approximately the following. If you're applying for a skilled worker visa for 3 years, it's approximately £1,872. If you're coming on a skilled worker visa for 3 years with 2 dependents, you're looking at paying £5,616. If you're looking at a student visa, which is a master's course for 2 years, you're looking at £1,175. And a student visa, which is a master's course for 2 years with 2 dependents, you'll be looking at £3,525. Now, like you might have guessed, the health surcharge depends on who is applying and how many people are applying as a part of that visa, which visa you're applying for, and all of that. If you'd like to get a better idea of how much you'll be paying as your health surcharge as a part of your visa costs, it's very simple. All you can do is visit this link or visit the description box below where I have put the link out. Click it, fill out all the details, and you'll know how much you'll pay. So how do you get access to this healthcare? Well, for starters, you need to register with a GP or a general practitioner. To register with a GP, you need to sign up with a surgery, which is a clinic over here, and you can honestly opt for any clinic you'd want, typically something close to your house. Sometimes surgeries can turn you down if they are too full, so that's something you should bear in mind. Now, in order to complete the registration, all you need to do is pop over by the surgery and they'll hand you a bunch of forms, fill out the forms. They'll normally also ask you for your passport to prove that you're here legally and your proof of address, for which you can show them a utility bill from the home that you're currently staying in. Now, if this is the first time you're registering with a surgery in the UK, you'll obviously not have an NHS number, so don't worry about that. When you do sign up with the surgery, they will apply for an NHS number on your behalf and give you the number. Now, if you're new to my channel, here's the thing. I make videos on everything about moving to the UK, how you can get admission to schools, how you can move to the UK, jobs in the UK, how you can bring your belongings along. It's all covered on this channel. So if you haven't hit that subscribe button yet, now's an absolutely great time to do it. Hit the subscribe button now and click on the bell icon for notifications. So what happens if you need anything from vaccination shots, or if you have a fever or a backache? What is the first step you do? As your first step, you first call up your surgery and make an appointment. Now, you can be given an appointment date anywhere on that day or even 2 weeks from then. Anything is possible depending on how busy they are and the actual requirement that you have, the nature of your requirement, or the nature of your illness. Everything depends on that. Back where I'm from, if you're not well, you typically walk into a clinic. So can you do that here? Can you walk into the surgery and ask for an appointment, or just ask to see the doctor? Some surgeries do have specific hours during which they allow walk-ins, others don't. So it's really important you check that before you just walk into your surgery, which is also why I suggest you make an appointment either by giving them a call or logging onto an app if they have one. Almost all surgeries work only from Monday to Friday. Mine, for instance, works from Monday to Friday from 7:30 in the morning to 6 in the evening. And after that, they're shut, so you're not going to get any help from them. Now, another difference is back home where I'm from, if you need to go to a doctor, you usually look for a specialist. So you look for a gynecologist or a neurologist or a physiotherapist, something like that. But it doesn't work like that over here. Here, when something's wrong with you, you first ask to see your GP. Your GP will check you, and in most cases, they help you sort out the issue immediately. In some cases where you need a specialist, they will then refer you to a specialist, and then they make another appointment with that specialist. Again, that appointment could be the next day, or it could be maybe a month later. Anything is possible depending on how busy they are. Now, the good thing is most of the appointments don't take too long. They usually take like 5 or 10 minutes. And the other good thing is the wait time is also usually not too long. Like in India, I have been waiting for doctors at times for even 2 hours, even though I had an appointment. But here, the wait time is typically very short, so that's really good. Now, once the GP examines you, and if you need prescription medicine, they will give you the details of which pharmacy you should be visiting. If you have a nominated pharmacy, the prescription goes directly to the pharmacy. So all you need to do is hop over to the pharmacy and buy your medicine from there. They won't give you a prescription like they give you back in India, for instance. Now, which part of this is free and which isn't? You typically don't pay for your consultations, so your consultations are free as a part of the NHS, but you do need to pay for the medicines that are prescribed to you. Of course, this doesn't apply if you are under 16 years or if you're over 60 or if you're pregnant. In these cases, your prescriptions are entirely free. If you'd like to know if you qualify for free prescriptions, it's very simple. I've added the link in the description again. You can just click on it, fill in the details, and it will tell you if you qualify for free medicines in the UK or not. Now, if you've been with me till now, you'll realize everything is great. The system works without a problem. But here's the thing, this is where it gets a little tricky. Like I said to you earlier, GPs run from Monday to Friday and within certain timings. So what happens if you fall ill on a weekend, for instance, or outside of these timings? Let me put it this way, try your level best not to fall ill on the weekend or outside these timings, because that can be quite a challenge, to put it mildly. Now, if you need healthcare over the weekend or during timings when your surgery is shut, the first thing for you to do is call 111 if the injuries you have are not life-threatening. Now, the challenge is that when you call 111, it can take almost 10 minutes for you to move from the IVR to actually speak to somebody and explain your problem. So you're going to speak to someone, they're going to understand what's wrong with you, and then they will schedule a call back with a doctor. The doctor can call you anywhere between 30 minutes and 4 hours. That's the challenge now. Now, part of the reason why this happens is because the NHS receive a lot of calls outside normal hours. So they're honestly flooded with calls, and it's also because this is exactly how the system works here, because it's a public healthcare system. So if you fall ill over the weekend, you're honestly looking at a really long wait time before you actually meet a doctor. Now, if you're from India, like I said, like we are, you might be tempted to just drive over to the hospital, and that is what we did when somebody in my family was a little unwell over the weekend. We drove over to the hospital, and there was a small department, which was an outpatient department, that was operating on the weekend, and they told us we couldn't see a doctor without an appointment and we had to call 111. So this was at about 10 o'clock in the morning. We tried calling 111. By the time we actually got a call back, it was maybe 1 or 2 hours later, and even then the appointment wasn't really scheduled. And here's the tricky part, because we live in Maidenhead, which isn't a city, it's a small little town. We realized that we didn't even have an A&E or an accidents and emergencies department in Maidenhead. So in our case, because the person was extremely unwell, we then had to drive over to the next town and find a hospital which had an A&E department that was open. And in case you're really unwell, this can be quite a tricky scenario. And even after we got to the next hospital, there was approximately a wait time of 4 hours, which is apparently very normal over here. It's anywhere from 4 to 8 hours every time you hop over to the hospital for an emergency. Now, after all of this was done, it was quite late in the evening, and the next problem that happened was most of the pharmacies were shut by then. So my honest feedback to you is that if you need medication, ask in the hospital that you're in, ask them what the closest pharmacy is and ask them to send the medication over there, because if you think that you're going to go to your regular pharmacy, there's a very strong likelihood that it might not even be open. So to put it simply, if you are in an emergency and all the surgeries around you are shut because it's the weekend or outside operating hours, here's what you should do. The first thing you do is call 111 if your injuries are not life-threatening. If they are life-threatening, call 999 immediately. If you are calling 111 and you don't want to wait over the call, you can schedule a call back instead by visiting their website. You can just schedule a call from the website itself instead of having to wait. Now, if you can't wait for services to get to you, figure out what the closest A&E to you is. If you don't know how to find that out, you can just write A&E open near me, and it'll throw up a link for an NHS website, and Google will also show you responses. I've also put this link in the description below so you can check and find out which A&E is open close to you. They will also typically tell you which ones have longer wait times, so depending on the severity of your issue, you can decide where you want to go. If it is over-the-counter medication, you can just pop by whichever pharmacy you see which is open. Don't wait too long, like I said, and just get whatever medication you need. If it's prescription medicine, ask the hospital what the closest pharmacy is. Ask them to send the prescription over to them, and then hop over there immediately. And again, Google out and see if the pharmacy is open or not, because again, in small towns, a lot of the pharmacies close earlier than you expect. Now, here's the thing. You can also opt for private insurance, which most of the people in the UK don't opt for because it's an additional cost. But along with private insurance come a lot of perks like shorter wait times, access to a lot of specialists, quicker responses. So that is something you can consider. Now, two of the most prominent insurance companies in the UK are Allianz Care and Cigna Global, which you can consider if you're interested in opting for private insurance. Now, you might be tempted to go to a private hospital in case you are facing a health scare and you don't have much time on your hands. But here's the thing. Appointments in private hospitals in the UK cost anywhere from £100 to £250 just for a 30-minute consultation. And the actual treatment can go into thousands of pounds. So before you go into a private hospital, ensure you have healthcare and ensure you know what their rates are. The other challenge with some private hospitals is that they don't take appointments on weekends. So even if you need urgent medical healthcare on weekends, you might not be able to access them. So again, it's something you have to check before you actually visit the hospital. Now, unlike healthcare, dentistry in the UK is actually chargeable. So whether you go through the NHS hospitals or if you go to a private hospital, in both cases you have to pay. Now, how much you actually pay depends on the band of healthcare that you require. In England, the structure works like this. The first band, that costs £23.80, includes dental examinations, scale and polish if required. The second band, which is £65, covers fillings, root canals and removal of teeth. The third band, which is the most expensive, is £282 and covers crowns, dentures, bridges and lab work. Now, in case you need emergency treatment in the UK, that's £23 and it covers emergency care such as pain relief or temporary fillings. Now, here's the thing. If you're looking to move to the UK and you don't know where to stay and you're still evaluating places, especially if you're going to work in London, here's the good news. I've already got you covered because I've made an entire video on where you can stay if you're looking to work in London. All you need to do is click this.